And for our final recording this week, I'm just going to do a quick tutorial on how to do blood pressure, how to take blood pressure. If we were in the lab, everybody'd be practicing on each other. So if you have the opportunity, if you have a friend that's got a blood pressure cuff and a stethoscope, and you can practice this, that would be a great thing. It's something that's good to be good at before you start your first job. That's very often something you get asked to do. Some of you are already doing it all the time. That's fine. If any of you wind up getting together and you can help each other out, that's fine too. Obviously, social distancing and wearing a mask and stuff the best you can. But anyway, taking blood pressure is a pretty simple thing. All you're doing is putting a cuff around your arm and smashing the blood vessels so that no blood comes through. And then you let it go, and as soon as the pressure is high enough to start squirting through, it makes noise. Boom, 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 boom. And you can tell that's what the pressure was when the cuff was squeezing only that hard. So it's a fairly straightforward thing. It's been done for years. Taking it manually is still better than any of the machines that there are, although it takes practice. When you first start doing it, you'll find that you can't hear it, and you think, well, I just can't hear it. But you'll get better at it. Suddenly, it becomes obvious. You can pick it up from the background noise and so forth. So here are the parts. You have your blood pressure cuff or sphygmomanometer, and it has the bulb for adding the pressure, and it's got the readout, which normally is clipped on here, but I'm going to hold it up so you can see it when we do it. And you have your stethoscope. You can feel like a doctor or a nurse when you got one of these around your neck, so that's always kind of cool. The way you use a stethoscope is you set it so that the earpieces are facing away from you, not toward you. If they face toward you, they're going to hit the skin in the back of your ears, and you won't be able to hear anything. So they face forward, away from you. Put them in your ears. Make sure that they seat in well enough that it blocks out some of the outside noise, especially if it's a noisy environment. Now, I'm going to take these out so I can hear myself talk. Here's the diaphragm, and you will tap lightly. Otherwise, you'll blow your eardrums out, and make sure that you can hear it. If it's turned around backwards, so that this is the side that's hearing stuff, you won't hear anything, and you won't be able to figure out what's going on. So you want to make sure that the diaphragm is actually facing in the right direction, and it's making the noise. Okay, I have an arm over here that's going to appear in my view. Oops. Of course, I have to have a glitch. There we go. Let's try this again. Okay, so here we have the arm. I'll roll it up. Okay, the best place to put the diaphragm is not right on top of your biceps tendon, but slightly medial to that. There's an area right here that's kind of a little hole, and you can get down in there pretty well and be able to hear. Over this way a little farther. You'd be able to hear it pretty well. So not exactly in the middle, just slightly medial and right in the crook of the arm. And it's best to hold it with your fingers rather than your thumb. I can't ever hear my thumb pulse, but they say that you can sometimes, and it can throw you off. So anyway, you're holding it like that. Now the cuff itself goes on. You can see the range here. You know, it says here, you put this on, so it's just inside here. Velcro doesn't stick to skin. So remember that. As you put it on, put the Velcro pointing out. You can put it on pointing in, and sometimes it'll stick on, and then when you're pumping it up, it'll fall off, and you look like an idiot. And you don't want to look like an idiot. So make sure it doesn't have a lot of air in it. Stick it on there. Hold the bulb in your hand here, if I can show you here. And righty-tighty, lefty-loosey, righty-tighty, lefty-loosey. You want to make sure that it's workable, because if the last person left it so tight that you can't get it loose, you'll pump up the thing and the person's arm will fall off before you can get it loose. Try it out, just barely finger tight, and we're going to pump it up until the pressure gets up to, probably 160, 170. You can try it out and pump it up until their pulse stops, and then you know you don't have to go a lot higher than that, and it's more comfortable if you don't have to put it really high. But if I hold this on here, could you hold this? See if you can hold that. Oops. Up in front of the camera. Yeah, like a little higher. Yeah, something like, sorry. There's the camera. Just put it right in front of the, yeah, that's going to be good enough. Okay, perfect. Okay, now watch this. Righty-tighty. Now I'm going to pump up. In this case, I'm going to pump up to like 160. Now, see, this isn't working. Brand new blood pressure cuff. I couldn't possibly have one of these lectures today go without a technical error. It's like the story of my life today. Okay, let's try it again. Okay. Yeah, if you can put this so that it says where the artery is on the left arm, the right arm, that helps to have it sort of centered properly like that. Okay, let's try this again. So this is positioned a little differently, so maybe this will work better. I've never done it from behind somebody before. And I've never done it with them trying to hold the thing either. Yeah. Just hold it right in front of the camera. Oh, yeah. Okay, pull it back a little bit. Yeah, if you can hold it around there. Okay, I've got the sphygmomanometer on here, and see, look at this. I mean, I have the stethoscope on there. So I'm going to go up to, in this case, I went up a little high, but I'm going to start down. And when I hear, start it down, when I hear boom, 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 the first sound I hear is systolic blood pressure. You can come back a little bit farther so it's not that close. Yeah, that's better. Boom, 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 boom. You can see the needle bouncing too. This is really hard to do backwards. Boom, 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 boom. That looks better. Okay, about that speed. You don't want it so slow their arm falls off, but you don't want to do it so fast that you miss some beats. So I'm going to do it again, see if we can get it a little bit better this time. I'm going to go to about 160, 180, and start down, and I'm listening, and I hear boom, 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 boom. When it stops, you've reached their diastolic blood pressure. So the first sound is your systolic pressure. Your last sound is your diastolic pressure. And when you're done, loosen the thing the rest of the way up so their arm doesn't fall off. Okay? Just to reiterate, again, tighten, righty-tighty, pump up to maybe 160, 180, start loosening it slowly. The first sound you hear, boom, 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 boom. The first sound is the systolic, boom, 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 boom. It'll stop. The last sound you hear is their diastolic. You write it down as 120/70, or whatever the blood pressure turned out to be. See if you can get a chance to practice that some.